Comments and viewpoints on this program are not necessarily those of station ownership, staff, or management. Welcome into the Patient First segment, presented by Excel Rehab and Sports, with locations in Easley, Clemson, and Seneca. Excel Rehab and Sports offers physical, occupational, and hand therapy, being their best to make you better. There is a difference. It's their Patient First mission.
Good morning and welcome into the Patient First Mission segment presented by Excel Rehab and Sports. I'm Chad Dorsett. Honored to be joined this morning by Tim Moore. He is the Chief Operating Officer and Chief Financial Officer for Excel Rehab and Sports. Good morning, Tim. How are you?
I'm doing well, Chad. How are you doing?
Doing great. We want to talk about when choosing a provider, you're actually choosing their people. But before we get into that, let's talk a little bit about Excel Rehab and Sports. You offer physical, occupational, and hand therapy at 3 convenient locations in the upstate of South Carolina: Clemson, Easley, and Seneca. Tell everyone what Excel Rehab and Sports is all about.
Well, Chad, good to be with you again this morning, and I hope you're looking forward to a great Thanksgiving. Regarding Excel, we provide, as you said, physical, occupational, certified hand therapy, and with occupational therapy and hand therapy, we sometimes refer to that as upper extremity therapy. A lot of folks get confused when they hear the term occupational therapy, and they think that, that's only therapy that I need if I've gotten injured on the job, and that's not the case. So we provide physical therapy, upper extremity therapy, certified hand therapy, and we have 3 great offices in the upstate of South Carolina, in Clemson, Easley, and Seneca, and we also have a new office in Chattanooga, Tennessee.
Wonderful. Let's talk about the free screening that Excel Rehab and Sports offers. Essentially, you can call 864-654-2001, that's 654-2001, and set up a free screening with the physicians there at Excel Rehab and Sports. Tell me about setting up that free screening and going in and being able to meet one-on-one with a therapist.
Well, we offer the free screens as a way, and we've talked about it many times on our show. We offer the free screen as a way to help patients learn more about what physical therapy is, what occupational or upper extremity therapy is, to get familiar with our clinic or our facility, and to get familiar with our people, and then also for them to be able to learn about their what injury they may be experiencing, and to hear from the therapist what a course of care might be for them.
Also, another thing that Excel Rehab and Sports prides itself on is being your best to make patients better. That is the Patient First mission, and there is a difference. Tell me a little about that mission statement of being your best to make the patients better.
Well, I think that goes along with the topic of our show today, and that is, when choosing a provider, you're choosing their people. And for Excel, we show up every day to take care of our patients. That is the only job. And with that comes really an extremely high expectation of our people. And for us, what we do every day is not it's about the patient. Everything we do starts with, first, how is it going to affect the patient? How do we take care of that patient? How do we provide the highest level of care for that patient? How do we get that patient taken care of and get them back to work, back to life, back to play? So that's our mission statement. It's just 2 words. It's patient first. There's nothing fancy or not a lot of hype with it. Some folks may think that it is a boring mission statement. Most people expect to see mission statements written on the wall. We don't write our mission statement on the wall. We put our mission statement in what is required of our people every day. And we put the mission statement to work taking care of people. Because, as I said, that's why we show up. We show up to take care of people, nothing else.
Tim, this morning we wanted to talk about when choosing a provider, you're choosing their people. And you told me that you really look at this as patients needing to conduct essentially a job interview with their prospective therapist when going and learning about what services they provide. Give me your thoughts about that, treating maybe that initial visit, that free screening, as a job interview to see if these are people that essentially you want to hire to be your therapist.
Yes. Well, when we're looking for our people, when we're looking for our team members, one of the things we first look at is, or one of the things we say to ourselves is, how would one of our patients interact with this person? How would one of our patients feel being taken care of or being served by this particular person? And that's kind of where we start our interview process, and that is where we focus our attention on the people. Yes, of course, those folks have to have the skills that they need, especially if they're a licensed, provider, one of our therapists, whether they're the doctorate level or the master's level. Of course, they have to have those skills. They have to be licensed. But to us, it's more than just the skill level, because patients and their families know quality care when they experience it, and it's a result of great people and the skills that those people have. You can have just, normal, regular, run-of-the-mill people that have great skills, and that would most likely not meet what our expectation level is of our staff. And that in and of itself, as I mentioned a moment ago, creates an extremely high expectation of our team. So as I mentioned before we started the show, when we're interviewing potential team members, it's an exhaustive, emotional process for us. It is not. It's not an easy process of getting resumes in, conducting interviews, and then just selecting from the candidates based on the qualification they had on paper and a 30-minute interview. We typically go through 1, 2, sometimes 3 interviews with the same person, and they will interview with different members of our team so that we make sure they fit in all levels of our organization. So hiring is not easy for us. It is tough because we know the people we choose can have either, and it's simple, a positive effect or negative effect on our reputation, and that reputation affects what people think about our quality of care. So the people are an extremely, extremely important component to it. And so when I talk about choosing a provider, you're choosing their people. It's not about when you're going to a provider. It's not about the equipment that they have or their hip social media posts and photos or the cool swimming pool they have for you to do walking exercises and things like that. That's why we offer the free screen, because a lot of people are not familiar with what physical or occupational therapy is. It can be a scary new part of their life, and the free screen offers them an opportunity to come to one of our clinics and not just get a feel for, okay, where's the location, how far of a drive is it from my home or from my work, is it a nice facility, is it clean? That's all easy stuff for us. But what we want them to get the feel for is our people. So when I taking the conversation back to when we are interviewing potential team members, one of the things, when we're talking about how patients will perceive people or our team members, and we're talking about that patient being scared because this is a new thing for them. They've never been to physical occupational therapy before, a totally new experience. They've experienced an injury or an accident, or one of the examples that I like to use is you have a husband and wife whose lives have been changed forever. The wife has just had a stroke, so nothing is ever going to be the same for them again. So that patient or that husband and wife who have now had their lives changed forever because she's had a stroke, nothing is going to be easy for them like it used to be. And not that life is always easy for everyone, but just the normal day-to-day is different now. Just getting out of bed every morning is a challenge. So couple that with your life being changed, and now you have to find a way to get yourself and get your wife out of bed, who now needs assistance doing that, and driving to a physical therapy provider 2 to 3 days a week or once or twice a week. And you can get a sense for the importance of the people that you're going to be seeing and engaging with daily. So when we're interviewing team members, I like to use that as an example to say, those are the folks that we show up to take care of every day. So we may have a headache. We may have had a flat tire this morning in the rain. We may have run out of gas and had to walk 5 blocks to buy a gas can and then walk back to fill our car up. Yeah, that's not fun, and nobody wants to experience that. But whatever our experience is that morning is probably nothing compared to what that husband and wife are experiencing. So we have to be, and as you said it earlier, our best to make that patient better every day. So that's our high expectation, Chad. And when you're looking for a provider to take care of your wife or to take care of you because you've had an injury, a bike accident, or you've got an elbow issue from playing too much tennis, you have to think about the people that you're going to be engaging with and those folks that are going to be taking care of you at sometimes your most vulnerable time, and make your choice of that provider.
We're talking with Tim Moore. He is the Chief Operating Officer and Chief Financial Officer at Excel Rehab and Sports. And we're talking about when choosing a provider, you're actually choosing their people. Tim, I was hoping you could talk a little bit more about the relationship between the patient and the therapist there at Excel Rehab and Sports. Tell me a little bit about this relationship and how it's formed, how it's maintained, and how it helps the patient all the way through the recovery process.
Well, I think with the therapist, it's really no different than with our patient care coordinators or even the folks in our finance and operations department, because we're all working toward that same mission the skill level and the license for that therapist is an important component to that patient's level of trust in the therapist that's going to be taking care of them. So from the free screen perspective, again, we offer that as a way for that patient to get comfortable. So when a patient calls to schedule that free screen, they're going to be able to spend time with that particular therapist, and they're going to be able to ask questions. They're going to be able to hopefully understand more about the physical therapy process or the occupational therapy process, dependent upon the type of injury that they have, those particular therapists, and I'm not a therapist, so, I don't get involved in plans of care discussion, but that therapist will be able to educate that patient at the time on what, again, physical or occupational therapy is, what they can expect from getting their care at a particular provider, and based on the information that is provided, and based on the feel that patient has in that interaction with the therapist, that patient is then able to make a choice. And back to what we've been talking about, if that therapist does not have the skills in addition to what it took to get their license to be a therapist, that interaction is probably going to be a little bit different, and that patient may not choose a particular provider based on the person. The skill level may be there, but they may just not connect, and that's an important part of therapy is the engagement, and that's one of the things also with Excel is our therapists are the only ones treating a patient when they're in our facility. Some providers have what they call technicians, and those technicians sometimes are involved in delivering care. They're walking patients through exercises. They are instructing patients on those exercises, and we don't allow that to happen. That's one, against the Practice Act, and two, those technicians are not qualified. They're not skilled in therapy. They're not licensed in therapy, so they're not usually part of that free screen process, which is why we want our patients or potential patients, when they come for those free screens, they spend time with the therapist. They don't spend time with anyone else.
Tim, another big difference at Excel Rehab and Sports is the fact that you offer hands-on therapy. Much of the therapy there is hands-on with a therapist and a patient or a client, as opposed to sitting a client down or a patient down at a machine and having them go through exercises at a machine for an indefinite time, and then the therapist coming back and kind of checking on their progress. Talk to me about that difference, the fact that you offer hands-on therapy.
Well, that's one of the big differences, one of the many big differences between Excel Rehab and Sports and other providers is the level of hands-on care that we provide. And it also associates with what I was just speaking to, the use of technicians in the clinic or aides in the clinic to assist in that plan of care. We just don't do that. Our aides may push buttons on a piece of equipment, but the therapist tells them what buttons to push, how long that patient should be on that piece of equipment, and then the aide will stand there and just make sure that the patient doesn't have any questions, and then brings that patient back to the therapist. When I mentioned earlier that it's not about the facility and the amount of equipment that they have, equipment's important. Equipment is, we use equipment, like treadmills and ellipticals and things like that. We use those to get patients warmed up, to get their bodies prepared for their therapy session. But we don't use equipment as the therapy. And that's an important difference. Typically, organizations do that when they have too many patients in the building, and the equipment becomes the babysitter for the therapist because they have too many patients to take care of at one time. So we schedule our patients in such a way that our therapist has more than adequate hands-on, one-on-one time with that patient while they are here. They're not being attended to by other individuals in the clinic.
Tim, in regards to our topic, when choosing a provider, you're choosing their people. What sort of questions do you recommend patients have for the provider in order to make sure that it is the right fit?
Well, I think, if you're talking about the provider, or if you're talking about the therapist in general, it's just getting educated on what physical therapy is. Get educated on, how many days a week might I need to come, and that's typically based on the physician's prescribed course of care. If they've come in for a free screen, there's a different approach to getting to that answer, and usually, if we have determined that yes, it's probably something they're going to need to see their physician about, the physician then makes that determination on what that plan of care, course of care will be, how long they'll need to be seen, how many days a week, for ever how many weeks. Sometimes it can just be one visit or two visits, and we can send them home with a home exercise program, and we continue to stay in touch with them to make sure things are going well. But sometimes their particular injury requires significantly more time in the clinic and more hands-on time with a therapist. So it's really getting educated on what the process is going to be like. What is a typical therapy session? What does that consist of? What happens when I show up for my first visit? What happens when I show up for my second visit? What am I doing when I'm not in your clinic? If I'm seeing you twice a week, what am I doing the other 5 days of the week? What do I need to be doing? Because it's important for the patient to be engaged in their care, and not just when they're in our clinic doing what they're supposed to do. When they're at home, sometimes they need to be doing their home exercises because it helps their body to continue to heal, so that when they are coming in when they're actually in the clinic, the body hasn't slowed down that healing process. Things don't stop.
Tim, we're almost out of time. Anything else that you want to mention to listeners this morning in regards to the Patient First mission at Excel Rehab and Sports?
Well, I would just say happy Thanksgiving to everyone. I appreciate you having us on the Patient First mission segment again. Look forward to next time. And, just in looking for a provider, you need to look at the people. You choose the people.
Listen, Tim, as always, thank you so much for all the education, and thank you for what you and the folks at Excel Rehab and Sports do for our community. And just as you said, happy Thanksgiving to you and yours, and look forward to talking again soon here on the Patient First Mission segment.
Great talking with you, Chad.